5 warning signs of cervical cancer. If you are a lady, please don't scroll. Stay to the end of this video. Today we are going to talk about 5 warning signs of cervical cancer. You are probably ignoring these signs just because you don't know that they are signs of cervical cancer. So today we are going to talk about these 5 warning signs, okay? Number 4 will shock you. Stay to the end. The first warning sign of cervical cancer is pelvic pain. Yes, pelvic pain. You will have this persistent pain in your lower abdomen. You're not in your cycle. You're not ovulating and you're not menstruating. But this pain keeps coming, very persistent. It's not stopping. No matter the type of pain relief drug that you took, it's not stopping. And again, you don't have infection. You have done high vaginal swab and the result says that you don't have infection, but that pain keeps coming. It's a sign of cervical cancer. The second sign of cervical cancer is vaginal discharge. Yes, this vaginal discharge comes with this awful smell that you have not experienced before, and you don't have infection. You have done HVS, you have done urinary analysis, and you don't have infection. But this smell is very awful, okay, with discharge. It's a sign of cervical cancer. Yes. The third sign of cervical cancer is bleeding in between periods. Yes, it's a sign of cervical cancer. You're done with your menstruation, but you're still spotting or sometimes the blood is still coming out, fully. Bleeding in between periods is one of the major signs of cervical cancer. The fourth sign of cervical cancer, remember that I told you that the fourth one will shock you, yes, is swollen legs. Yes, you have swollen legs, very heavy and painful. And it happens in one leg. When you start feeling that one of your legs has started swelling, okay, and very heavy and painful, is a sign of cervical cancer. Yes. The fifth one is painful sex. Is a sign of cervical cancer. If you don't normally have this painful sex, you don't normally have it, all of a sudden you start having painful sex, is a sign of cervical cancer. So if you're a lady and you see any of these signs, please go to the hospital, go and talk to your doctor, request for human papillomavirus test, okay, HPV test, please, or pap smear, okay. HPV test or pap smear test is going to dictate if you actually have developed this cervical cancer or not. Please, your doctor knows what to do. He will take it off from there, okay. They say early detection is key. Don't allow this thing to worsen, okay. If it's detected early, definitely by the grace of God, you will be treated and you will be okay. Hope you learned a lot from this video. Don't forget to share and don't forget to subscribe to our channel. We'll see you on our next video. Bye bye.